here at the CUPT program, and I coordinate the recruitment and admissions committee. And I'm also a graduate of the program. So I graduated in 2011. I still see patients today. So I'm happy to speak to you on behalf of the faculty and as well as being an alumnus. And then with me is Natalie Palmer. Would you like to introduce yourself, Natalie?
Yeah, absolutely. I'm part of the admissions team here. If you email us, it'll be Amy, Kristen, or myself who will probably be answering your back. I'm a Colorado native, and I have worked in higher education and healthcare IT in Washington, Colorado, and Pennsylvania in both metropolitan and rural areas. Glad to be here.
All right, so we're going to dive right in. When we think about the University of Colorado, there's actually four campuses. We've got a campus in Boulder, and then we've got our Denver campus, our Anschutz Medical Campus, and then furthest south is our campus in Colorado Springs. So this is our CU system. When we think of the CU Physical Therapy program, we're going to be looking at these bottom two right photos. The Anschutz Medical Campus is where our residential pathway is housed. And our hybrid pathway has our lab immersions at our Colorado Springs campus. So yes, you heard that correct. CUPT has two pathways to consider. We have our residential pathway at the Anschutz Medical Campus. We've been in existence for over 75 years in terms of our residential pathway. And then just starting our second cohort of our our hybrid campus, we have hybrid students who do their lab immersions in Colorado Springs. We have to specifically design these two pathways to look parallel. So I'm going to speak a lot today about our curriculum, about the different steps that the students take through their education, both clinical and didactic. And we really designed our two pathways, the residential and hybrid, to be parallel in terms of the campuses and the resources. So while I'm going to cover a lot here today verbally, our website has a really great FAQ page that sort of describes the differences between the two pathways and when there is similarity. So feel free to scan here, and Natalie can put up in our chat the FAQ page as well. But again, I'll dive in covering a lot of that here. So our curriculum is 2.5 years. And I mean it when I say that we have one program, we have two different pathways. And so both pathways have the exact same curriculum. We start in the summer and we graduate 2.5 years later in December. Spread throughout is our scope of practice in terms of orthopedic, medical, neurologic. We have evidence-based practice courses. We have clinical pieces of the curriculum. We have a lot of patient care in terms of exam and eval, and then we have our foundational sciences. So you'll notice here, one of the unique things about our program is that we spread our clinical education experiences throughout the whole curriculum. So you are in clinic early and often. So the green blocks on this slide, and this slide is available on our website, so you can download it and look more specifically yourself. But the green blocks are our clinical rotation. So as early as the second semester or that first fall, our students are in clinic. And this is a philosophy that we have and maybe some other programs share of having students in clinic early and often. But as you look at PT programs, maybe this is something you consider. When do their clinicals fall? Because some wait to the very end. They do all the didactic portion first and then save the clinical rotations to the end. So this is just something to consider as you're looking at PT programs. Another something to consider is whether or not research is required. So in some curriculum maps for programs, you might see some required research components. For us, while we have research availability and any of our students can participate in research if they want to, we can talk about that a little bit later, it's not required. Our students do have a final, what we call capstone project that they complete in their final summer and present to the entire faculty, their classmates, but they do not have a required research component of the curriculum. So again, some things to consider as you're looking at differences amongst programs. So I've talked already about the clinical model being early and often, but another unique aspect of our program is a really robust interprofessional education curriculum. So because we're on the Anschutz Medical Campus, which is a huge interprofessional medical campus, it's the only one in the Rocky Mountain region, and it's, I think, something like 500 miles, but from the nearest health science campus like its kind. We have a really robust interprofessional sort of presence. And that includes 4 hospitals on our campus. So on Anschutz, we have the inpatient and outpatient hospital for the University of Colorado. We have Children's Hospital, and we have the VA. So we have a lot of lab instructors that are coming from these clinics to help in our labs. And then we have a dedicated portion of the curriculum where the students of all the different disciplines on campus, so that includes the medical program, pharmacy, PA, PT, nursing, dentistry. We've got a master's degree in uh, in applied anatomy. We've got an anesthesia assistant. So we have a variety of disciplines. I know I'm missing some as I'm labeling them all. And all of those students participate in what we call IPED, which is a course within the curriculum. And that happens throughout the 2.5 years. So our students are in groups with other students of other disciplines where they go through cases, they go through ethical scenarios, they learn about each other's scope of practice. And this is all threaded through the campus and the curriculum. This is happening both in person in our residential cohort and online in our hybrid cohort, because some of these other disciplines also have hybrid or online models. So this is available to both our students, regardless of either pathway. Now, as far as clinical education goes, again, early and often. So in the first fall, we have something called ICE, which is a collaborative experience. I'll go into more detail in a future slide. Then our students have their first independent experience at the end of the first year. So at the beginning, I guess, of the spring, or end of the spring, excuse me. Then in year 2, they have another collaborative experience in the fall, followed by a second independent experience, 10 weeks long. And then everybody culminates with a final rotation that's 16 weeks long. And then we have this opportunity, it's optional, for a post-graduation internship. So I'm going to dive into each of these here on subsequent slides. So ICE stands for Integrated Clinical Experiences. There's 2 of them, one in the first fall, one in the second fall. It's a collaborative group. You're in the same group for both of those rotations. You're assigned sites because they're local. So if you're an Anschutz residential student, you would be in the Denver metro area. And if you're a hybrid student, you would actually be doing these ICE experiences sort of congruently with your lab immersions. So you would be doing them in the Colorado Springs area. You would do one of them in an inpatient setting, you would do the second one in an outpatient setting, or vice versa. But we just make sure that you get a variety of experience. This is assigned, so you really don't have say in terms of where you go. But again, this is something that is done. There's no classes while you're in lab, and meaning that you go to lab, or excuse me, clinic, you're with the instructors, you're seeing their caseload, and in place of being in class during that time. So those are, again, local, assigned, collaborative. When we move to the independent experiences, any of those could be in Colorado or out of state. And they sort of, as the 1, 2, and 3 go on, you have more say in where you're placed. So in the first rotation, every student has a clinical education advisor, and you'll meet with that advisor to find sort of a suitable placement based on sort of your interests, your previous observation. So while you can give some input about your prior experiences, your desires, where you think you want to be as the years go by, they will ultimately place you in that first site. So again, you can provide your input, but more or less for those 8 weeks, you will be assigned something for CE1. For CE2, there's a lottery system. So our students will receive a list of all possible sites. They'll rank order their top 10, and then there's a lottery system amongst that top 10. So you have a little bit more say in that rotation. And then in the final rotation, you have the most say. You actually apply and you interview. And so you get to choose. Maybe you choose sites that are in an area of interest. Maybe you want to be a pediatric specialist. So you apply to all the pediatric sites and you interview and you see sort of, you then rank sort of what your top choices are. And then what the sites do is they rank their top applicants and they hope to match both your top choice and the applicant's top choice. If you interview somewhere that you don't think is a good fit, you can say that and you would not be placed there. So, students are encouraged to really apply and interview for as much as they're comfortable. Now, when I say that there's this post-graduation internship, I want to be clear of this sort of difference. So some students, they just want to apply, interview, they want to go to this rotation, they graduate, they take their board exams, and then they go on, they are, find their own jobs. But some students really want to have mentorship in that first year of practice. So we have worked really hard to establish some internship sites, is what we call it. So some students in a previously determined site that allows for this year-long internship would return to the same location after the initial 16 weeks. So they would do 16 weeks just like all their classmates. They would take their board exams, graduate, and then they would return to the same place for 8 more months. So they would be there for a year total. And those 8 months post-graduation would be paid. They would be at a reduced salary to allow for some mentorship time, but this site is specifically promising mentorship within that first year of practice. So currently about 10 to 20% of our students do this year-long internship, and our CE team is continuing to really work on site partnerships, not necessarily of acquiring more. We don't necessarily want just a huge quantity, we want quality. And so they're being very particular about which sites they are signing for this year-long internship. So again, this is a choice. Students could decide just to do 16 weeks. Students could decide that they want to apply for the internships, and some students could apply for both. I already used the example of applying for maybe a setting that you're interested in, again, the pediatrics, but maybe you want to apply to a location. So maybe those of you that said you're from Texas, maybe you apply to the Texas sites because you want to return back home. So regardless of what setting it is, maybe you apply to some CE3 options and some year-long options that are in Texas, just because, again, of location. So it's very personal why some students would choose, where they apply to and what they end up doing. But again, what happens after the application and interview is the student ranks their top choices, the actual sites rank their top students, and we go through a matching process. As far as all the clinical rotations are concerned, we have a requirement that they cannot all be in the same setting. So you have to have some variance of inpatient and outpatient. And then because we have a commitment to serve both our sort of underserved community and our rural community, we do require that at least one experience be completed in a rural or underserved area. So if you cannot move, for example, if you're a residential student and you really cannot relocate to a rural community, we would place you in an underserved location within the Denver metro area. But again, we do have this expectation that if you're able to work in a rural community, that we'll try and place you there. If you are in Colorado, in terms of rural, there is some help with housing. So there is a company called, or an organization called AHEC, Area Housing Education Consortium, that helps those in rural communities in Colorado with housing costs. If you are out of state, it is up to you for your own housing, your own travel, your own accommodations while you're gone. When I say out of state, I mean all 50 states. We have sites in Hawaii, Alaska, and all of mainland the United States. We do not have any international sites. And that's really our commitment to our accreditation, which is to graduate you as entry-level therapists in the United States. And so we, because of that reason, have kept all of our partnerships within the US. So I've spoken a lot and I've seen a lot of questions come through the chat. So Natalie, if you can maybe help me with what ones are outstanding and what ones maybe have had
Yeah,
answers.
we've got two questions for you that I think the group would like to hear about. Diego asks if he hasn't really seen a program that has clinicals this early. So, Laura, what would you say are the benefits of having students be in clinic this early, as opposed to doing all the didactic and then having the clinicals at the end?
That's a great question. And again, it's a sort of a philosophy of each program. We believe that it's a reminder to the students of why you're doing what you're doing. The whole first summer, it's like drinking from a fire hose. You receive so much information, you learn so much, both didactic and hands-on and clinical, that you practice with your classmates. And so in order to really make it stick, we think that it's applicable to go ahead and use it pretty early. It helps solidify, what am I doing? Do I really want to be a PT? Am I really understanding what I'm in here for? And it gets the students really excited to see, wow, I've already learned so much in just one semester that I can already start to apply. So all of our instructors for those ICE experiences know that you've only had a semester when you get to that first one, or that you've only had a year when you get to the second one. The instructors know that you haven't had all the curriculum, so the expectation is not that you would be able to treat a patient from start to finish. Maybe you only do a small section of it. And we think that the doing that practice even early is really beneficial. Now, again, that's our philosophy. Other programs might say, you know what, we want you to have all the information and then you go to clinic once you have it all. But it's to each their own in terms of what is more comfortable. But we work to both train the students and the instructors to know, this is where they are, this is the knowledge base that they have, these are the expectations at this point in time.
Great. And then our other question before we move back to the presentation is from Sophia. And Sophia is wondering, what specialties do you offer for the internship?
So because part of our accreditation and really the goals of all PT programs is to become a generalist PT, meaning that you will graduate being able to work in any setting with any patient population, any disease, diagnosis, disorder. You could be working in the neonatal ICU all the way to, advanced life and aging. And so we work to have a breadth of experiences. So when we talk about specialty, well, we do have some specialty experiences, right? There's some in sports, there's some in pelvic health, there's some in oncology, there's some in all these different areas, vestibular. Well, we do have some of those. We work really hard to make sure that you have a breadth of experience. We also work really hard to make sure you have a good learning experience, meaning that you're going to have as much hands-on at the clinic that you're working at as possible, that you will be directing the care as much as possible. We could contract with a really fancy clinic, but if that fancy clinic doesn't let students work with their patients, it's not a great learning opportunity. So we've worked really hard to make sure that all of the sites that we partner with have good student learning experiences and that you would be maximizing what it is while you're there.
And Laura, Diego has his hand up. Well, Diego, did you have another question?
Hi, yeah. Hello, my name is Diego Sanchez. I just want to follow up on the question you answered to me earlier. Thank you so much for the insight. It actually does make a lot of sense. But I guess my follow-up question to that is I have seen in a lot of other programs that before clinicals, they have like a comprehensive exam that happens typically at the end of the second year. Do you guys also have a comprehensive exam, or is that like pushed to the third year? Or do you also have a test that
Mm.
tests everything like at the second year as well?
Great question, Diego. So yes, we do have a sort of a comprehensive exam between the years. We have that both in written sort of questions or your typical test questions. We also have two time points where you would do patient simulations, where those are considered sort of comprehensive exams. So you would be working with standardized patient actors and actresses to simulate cases, and you would have multiple and a variety of types of conditions. And again, those are comprehensive. So we have multiple touch points to make sure that you're progressing through the program. But in our minds, especially that first fall, we still believe that that collaborative ICE experience happening right away is valuable. Now, those independent experiences, you wouldn't be able to progress through those unless you've met our sort of exam sort of time points or the standards that we have, to lead you to that point.
Oh, okay. Thank you. I appreciate it.
Mhm. I see one more question. To what degree would we be involved with patients when it's very early in schooling? Will we be the main caregiver? Is there, well, the PT is there? So, great question. Let's say you're in that first ICE experience, you've had the full summer semester. At that point, you've actually already learned a lot about some examination and evaluation, as well as some treatment strategies. And again, the instructors we've told what you've learned. So we might say this person knows how to do a gait analysis. They can watch someone walk and interpret maybe what might be going on. So maybe in part of the entire care that PT has, you're responsible for the gait analysis, or maybe the postural assessment, or something else that you've learned over the summer. So again, you wouldn't be the main caregiver necessarily, but you'd be doing parts of it. You would have your team of students with you, and you would have your clinical instructor there throughout that whole time. So All right, I'm going to go ahead and move forward. Natalie will keep me posted if there's other questions. But next, I want to go into sort of the day in the life of each of our pathways. So we'll start with the Anschutz pathway. I already mentioned sort of the amazing campus that we have with all these different medical disciplines on campus. So it's not an undergrad campus. This is a health sciences campus. We have all of those hospitals, all of those interprofessional buildings, but we do have some specific educational buildings. And those are shared amongst all the different disciplines. We do have our own dedicated lab space. So we have two PT labs that look identical. They're just opposing. And that's what you see in this bottom left picture. So we have camera system in the ceiling. We've got microphones, and then you see these screens in the front of the room. So the students can be watching both in real time on the screen as well as it's being recorded what's happening. So if you're in the back of the room and they're doing something, maybe at the hand, you might not be able to see that well, but we can zoom the camera in and we can have these screens, available to view as well as a recording. So we call this a simulcast capability because the two rooms can communicate with each other. They're happening simultaneously. The instructor can call on students in the other room. We've got video monitors in the back of the room showing what's happening in the second room. So this just allows us to spread out. We have now more students, right? So we have more instructors. We have all this space amongst two rooms that are happening simultaneously. So you can see here that a lot of the students are paired or in threes. Maybe one student is playing patient while the other student is playing PT, and they're learning, maybe it's an exam skill, a treatment skill, maybe a special test. There's also labs that are for our cadavers. So our PT students have a advanced anatomy in summer 1 and in summer 2. They have cadavers that they're dissecting both summers. And that lab space is absolutely beautiful. It's actually on the top floor of one of our buildings, beautiful skylights and windows looking west at the mountains. So you get sunlight, the ventilation is great. I say this because a lot of anatomy labs are in the basement. It's dark, it's dreary, but our campus has done a lot to really celebrate the cadavers and have it in this beautiful space. So we do have labs for anatomy both the first and second summer. Our residential students come to campus and we tell them to treat it like a full-time job. So we tell them to expect that they might be in class anywhere from 8 to 5 Monday through Friday. Now, while they're usually in class only about 25 to 30 hours a week, we want to make sure that they know that those are the timeframes that class could happen. Now, they might start late some days. They might end early some days. They might come in just for an exam and then they'd be done for the rest of the day. They might have some days off here or there. So, but we just want to say very clearly, it's expected that you treat this like a full-time job. The students always have a lunch break, 12 to 1. You see in this upper picture here them playing spike ball. It turns into recess. The students around campus know the PT students because they say they see them out on the quad playing. So the students are proud of that reputation. And Colorado has more than 300 days of sun a year. So even in the winter, we can see our students out there enjoying the sun. We do have 2-hour class sessions where we have a 10-minute break in between and then sort of a 10-minute passing period. Some of our labs are upwards of 4 hours long, and then sometimes we have full day labs. So just sort of thinking about the differences of the structure of the day. In terms of where students live, because we are not an undergraduate campus, there's technically not any housing on campus. However, just behind the parking lot, behind the library, there are 2 apartment complexes, the Fitzsimmons 21 and the Fremont, and then there's other complexes just in the vicinity of campus. So our students can walk 5 minutes from their apartment to the education classrooms. And so while it's technically not on campus, it's very close. Many of our students bike to campus. We have both light rail and bus routes direct to campus, so some students live where they can take advantage of public transportation. And then we help our students out by utilizing a Facebook group and our campus student service, so people looking for roommates or housing or opportunities, to transition where they're living or just meeting people, resources, where do you buy scrubs? All of those things are through this group. Aurora is about 15 minutes east of the Denver metro or downtown Denver and about an hour from maybe the closest mountain ski areas hiking. So a lot of our students are really interested in the outdoors, being active, and they're finding ways to participate with each other in those activities as well. I'm going to transition now to UCCS, where we think about learning happening in a hybrid setting or in a virtual classroom. So all the didactic work is virtual. You're still expected to be in class that sort of Monday through Friday for live class. And what I mean by live is what we're doing right now. You would be expected to be on Zoom, cameras on, and participating with your classmates. And that could be anytime, Monday through Friday, normal business hours. So there'll also be times where there's asynchronous material. So maybe you only meet live for 2 hours out of the day, and the rest of the day you're expected to be working on some asynchronous video modules, reading, some assignments. But then approximately 2 times a semester, you would be expected to travel to Colorado Springs, anywhere from 5 to 10 days in duration, to do your labs. So we call these lab intensives or lab immersions, where you do the hands-on portion and the in-person portion during that time frame, because PT is a hands-on profession. We've got to teach you those pieces. When you come to Colorado Springs, you would be responsible for your own travel as well as your own housing or hotel accommodations. We have seen that majority of our students who do not live in the Colorado Springs or maybe Denver metro area, what they do is they get an Airbnb sort of house together, and they split the cost amongst a large group of them. Others who live in Colorado Springs, maybe, will let people sleep on their couches and so forth. But again, it is up to the students to determine that. The Hibble Center, which is what you see here, is an absolutely beautiful building. And this is where the PT, as well as exercise physiology, nutrition, and there's an actual clinic here. So Centura has a sports medicine clinic in this building. But there's PT specific spaces. So they have their own specific lab where they work. And then they also have some cadaver spaces as well. We have a separate Facebook group and campus services for our hybrid students in order to help, again, sort of put them in touch and communicate with each other. So when I mentioned traveling to the Springs 1 to 2 times a semester, here's an example of what the immersion schedule might look like. So this is the summer. They start in the beginning of June. So maybe the first 5 weeks are all online, where they're learning all the content through those both synchronous, meaning live, and asynchronous learning experiences. And then maybe in week 6, they travel to the Springs for their first immersion. They go back to online, and then maybe in the final week where we would have finals, for example, and their last immersion of the semester. So this is maybe what a semester would look like. As far as Colorado Springs, I'm going to turn it to Natalie, who grew up in Colorado Springs, to just tell you a little bit more about that community.
It's true, I did. My parents live on one side of UCCS and my in-laws live on the other side of the hill. So I've driven past the campus a lot over the last 30 years. All right, so Colorado Springs is about an hour south of where Laura and I are sitting here at the Anschutz campus. There's sort of 3 things that you could say have impacted the culture of Colorado Springs. The first is the nature and outdoors. That's the home of Pikes Peak. The picture in the upper left-hand corner is Garden of the Gods, which is about a 15-minute drive from the campus. There are also bike trails, a really short drive, and you're into national forest land and lots of places to go hiking and backpacking, if those are things that are of interest to you. The second is athletics, and in the upper right-hand corner, that's a picture of the Olympic Training Center, which is, of course, where the headquarters for our Olympians and Paralympians. That is located south of the UCCS campus, but if you're at the Hibble Center, you may see Olympians and Paralympians in doing some training exercises, including using pressure chambers, wide treadmills, a whole lot of interesting equipment that's present there. And the final one is the military. And the bottom picture there is the United States Air Force Academy, which is located just north of town. Colorado Springs is home to the Air Force Academy, home to NORAD, home to Peterson Space Force, home to Fort Carson, and it's just a really strong part of the culture of the United States. There's also a lot of really great restaurants, some good shopping. It's a beautiful town, and a great place just to visit in case you are interested. Back to you, Laura.
Thank you. So I've emphasized with both that we want to have you consider your DPT education like a full-time job. You are expected to be in class again somewhere between 25 and 30 hours a week, and then you have your study, your homework, some of your work in addition to that. So it really is a full-time job. However, we always get the question, can I work while I'm in school? So some of our residential students do find that they've been able to work in flexible positions. So what I mean by that are positions that can be done in the evening or on the weekends. Maybe they work at the library and the circulation desk. Maybe they are interested in research, and so they are hired as part of one of our research teams doing student data entry. So maybe they're like a work study student. Others maybe work as rovers or DoorDash, Uber and Lyft drivers, you name it, flexible positions. So they find we've asked, and it averages around 6 to 10 hours a week. Now, while the hybrid pathway might allow for more flexibility, meaning that those classes and time for asynchronous material can be a little more flexible, we really encourage our students not to work more than about 10 to 15 hours. It's going to be a significant challenge to sort of try and juggle both of these. There is no part-time option to our program. You saw our curriculum map. Those courses happen in those semesters in that order. It's not like you can pick or choose. And if you are unable to continue the progression, it might mean being held a year in order to restart with the following cohort. So we really want our students to take this very seriously, being a student first. Now, as we think about opportunities on our campus beyond just our academics, one of our values is to serve our community, and that means both local. So up at Anschutz, it's our Aurora and Denver community, in Colorado Springs for UCCS, but also globally. So we actually have our students right now, our second year students just finished finals last week. There's an elective for students to go to Costa Rica as part of a global health experience. And so we have a group of students there this week as they go between their summer and their fall semesters. So we do have some global health experiences. Our local experiences, I want to highlight just a few. First is Stout Street. This is a clinic that's held once a month in downtown Denver to serve our community of homeless and uninsured patients. So they come in, they have an assessment by our students and faculty preceptors, and then they are given some maybe education or some treatment in order to, help with some of their various concerns. The Dawn Clinic is actually held on campus here at our Health and Wellness Center, and this is an interprofessional collaboration. So once a week, students from any discipline can host sort of a clinic night where a patient can come in with a complaint, and they could have a team. So maybe it's a med student, nursing, pharmacy, and PT student team that assess this patient. Maybe they determine this person needs imaging, or this person needs medication, or this person needs blood tests. And if they are determined eligible for PT, they can come back on a separate night where we have teams of 2 PT students and a faculty preceptor working an hour one-on-one with a patient. And so we have patients that can be seen, they can come more than one time. So if someone needs maybe 4 or 5 visits, they can come back. And so our Dawn Clinic is very much serving our Aurora community and specifically patients who are uninsured. Rusty Gloves is what you see in this upper right photo. It was a renaming of Punching for Parkinson's. So Parkinson's disease is a progressive neurologic disorder, and unfortunately, there's no cure. However, some research shows that you could slow the progression of this disease with high intensity exercise. And so all over the country, these high intensity boxing exercise groups have shown up for people with Parkinson's. We've got a couple through the Denver area. I think one in Colorado Springs, and I think Colorado Springs at UCCS also has something similar for patients with multiple sclerosis. When we say outreach, what we mean there is traveling to middle schools and high schools to teach these young students what PTs do. Maybe just put it in the minds of some of these, sixth graders that maybe PT is a career for them someday. We also go to rural communities, and we're really just trying to share what our profession does. Now, you heard me say at the beginning that our hybrid pathway is in its second year, meaning we just admitted our second cohort. So we're still really diving into what service opportunities UCCS and our Colorado Springs community has. That is sort of in development as we speak. And then this lower photo that you see here is a group of students who went to the Capitol, the state Capitol in Denver on our legislative day to speak to our state legislators about PT concerns and bills that are currently in Congress, both state Congress and nationally, related to PT. So there's a lot of ways that we can serve our community. Another value that we have is really the sense of belonging. So we work really hard on our campus to establish this sort of sense of community. And we really try and represent that through these sort of key things that I'll share. So we want to recruit and maintain and retain students, faculty, staff that feel a sense of belonging on this campus. That means fostering career development. Again, faculty, staff, students. We want to be respectful of each other, preparing our students for diverse settings, diverse healthcare communities. Our research, again, while it's not a required component, majority of our faculty have some type of research agenda. There's also research all over this campus. And so we really want to be at the leading front of that. And if you as a student are interested, most students just contact a faculty member that is maybe leading a research initiative they're interested in and start with just helping with some basics and maybe do more and more and more as their education continues. We want to partner with the community. We want a quality education that again has the sense of community and belonging, and then just overall goal of improved healthcare utilization, especially for our underserved populations. So I'm going to pause here. I've seen a ton of action in the chat. Natalie, if you'll help me tease out what questions there
Yeah,
are.
actually, the one that I was going to bounce to you is from Erin, and she's asking, how are terms organized going from like summer to fall, fall to winter? Are they broken up with breaks, or does the summer just flow continuously into the fall?
Good question. So we have at least a week between semesters, sometimes two, sometimes three, depending on sort of the schedule and the academic calendar. But I would say generally, you can sort of think of having at least a week off between semesters, whether that's, to be able to travel home or take a break or, go on a camping trip or whatever it might be. But we try and release our full academic calendars way in advance so you at least know when the semesters start and end. And then the day-to-day nitty-gritty, like hour by hour calendar, we try and get out at least several weeks in advance of the semester so you can sort of look. We do have mandatory attendance, and when students have to miss a class for a variety of reasons, we know that you may need to miss, but you have to put in a request. So whether that's a doctor's appointment or a wedding that you're attending, those are things that you have to request from that day-to-day basis. So we try and get you the calendar far in advance so that you can look sort of at your personal calendar as well as your academic calendar. All right, moving onward then, a really important topic that I want you to think about for all the programs that you're looking at, and that's the tuition picture, the financial information that they can provide. So for CU, we base our tuition on in-state versus out-of-state. Some programs don't differentiate that, some have just a flat rate, so make sure you're doing your research. We are really unique in that we allow, or we have the ability that our students who are out of state, if they move to Colorado and have lived here for a year, they are now eligible for in-state tuition. Again, that's really special. Not even all the programs on our campus allow for that. So the PT program is really unique that if you've lived in Colorado for a year, you can be eligible for in-state tuition. And usually 4 things are necessary. You would need a permanent Colorado address. You would need a Colorado driver's license, register a vehicle in Colorado if you have one, and you've registered a vote in the state of Colorado. And once those 4 things are met, our Office of Residency would help give you an exact date that you become a resident. And a year later from that exact date is when you would become eligible for in-state tuition. So we work with our students right away. Natalie put on the chat here the residency office. You can learn some more information there. But our students, right when they move here and start with orientation, we get them going on those residency requirements. Now that wouldn't apply to someone who's hybrid who decides to remain out of state. So I just want to be clear, you would have to move to Colorado and show those 4 things. No, I mentioned that it's based on in-state or out-of-state. We also base our tuition on credit. So you can see how the credits are broken down by year. So this next slide is fairly busy. This is a screenshot of the Colorado cost versus the non-resident cost. And you can see there is a substantial difference. So if we do the math and we say that you're in state for the entire time, this is using that spring of 2025 number, it would be just under 73,000. If we're out of state and you establish residency for your second and third half year, you can see the math here is 104,450. And if you're a hybrid student and you're living out of state the entire time, you would notice that you're at about 152,500. Now, these are subject to change. Unfortunately, we are not the ones who decide the tuition. This is decided by our Board of Regents through the entire Colorado system. So while we as a program can have a voice and say and do what we can to keep the costs down, we unfortunately don't have the final say. So always keep eye on the website and see if there's any subject to change. On our FAQ page, we have created a PDF document to show you the differences of maybe why someone might choose to remain out of state, to move, to be in state altogether, to choose hybrid, to choose residential, because this is very different for every individual. So you'll see in this scenario, this is someone who is out of state, they are residential, and they want to obtain residency for the second and third year. So that total tuition is calculated, and I did it based on this February date. We added in the tuition, fees, health insurance, etc. Cost of living. What does it cost to live in Denver? What is the cost of rent? Right? So this cost of living is simply just, day-to-day groceries, gasoline, those kind of things. Cost of rent being separate. And we have a cumulative cost estimate of 220,000. So this is someone moving to Denver for the residential pathway. Now, this next scenario is someone who's hybrid, who's decided to stay out of state. We decided they were from Salt Lake City, and they're lucky enough to have rent-free housing with family. So the tuition, again, much higher. But if you look at some of these other things like cost of living, the ability to live rent-free, I've included an estimate of using Airbnbs during the lab immersions over the whole course of the curriculum, and gas money from Salt Lake City to Colorado Springs. The cost is almost the exact same, 220,000. So please do your homework when you're looking at programs, not just ours, but thinking about cost of living, thinking about how much your rent might be, thinking about if you have immersions, tuition. This is really an important exercise for you as you're looking at any PT program. So this is on our FAQ page. There's a PDF you can download, but I encourage you to go through all of these scenarios on your own. So this image is the top 20 programs. So we're really proud that according to US News and World Report, we rank number 11. And you can see here that amongst the top 20 programs, not only are we really high quality, but in terms of in-state tuition, including fees, we are a very valuable program in terms of keeping the cost of tuition down. We have the same scenario here. This is for out of state, and this is someone establishing residency after that first year. Again, this number looks a little bit different because it includes some fees. Now, we did this is just the hard work of one of our staff members that went to the websites of all 20 of these programs and did the calculations themselves. So this is publicly available data, but we will say this is not set it, do not use this as, an argument to another program. We just did the math on our own to show that we believe that we are of this high value as it relates to the other top 20 programs. Now, unfortunately, I don't have a similar graphic for the hybrid compared to other hybrid pathways. And the reason is it's kind of different. It's not totally apples to apples. Some hybrid pathways have similar payment structures as their residential cohorts. Some have different, some have in-state versus out-of-state. What I can tell you is that we're right in the middle of what is competitive in terms of hybrid tuition costs. So we talked about the cost to relocate or the cost of living, maybe rent costs. But what other things should you think about? The application process itself is expensive. Those of you that are on PTCAS now are now seeing, oh gosh, I have to pay for all these things. Natalie will go into what those different costs are. But what about interviews? What if you're invited to an interview in person? You might need to fly somewhere, stay at a hotel. So you might need to consider that. So I just want you to make sure you're thinking about all these things as you're looking at and applying to programs. Now, what about the other side? So forget tuition, right? What about salaries? There's really three big things. First is where you live. So here's a map of the country. You can see here that the different colors of blue are the average wages. And you can see that the most well-paid PTs are sort of in these areas that are also of high density population as well as high cost of living. So for example, the New England area, while you might be paid more, that cost of living there is definitely higher. And same thing, you might not be paid quite as much in states like North and South Dakota, but the cost of living is much less. So where you live matters. The second thing that matters is where you practice. So the type of setting. And unfortunately, I don't have data more recent than 2021, but you can at least see here the trends of and the comparison. So for example, the very top line is someone working in an outpatient practice or private practice. The very middle is someone working in a skilled nursing facility. And the very bottom is someone that maybe works in a school system. So maybe they work in a K through 12 school system as their school-based PT. So you can see there's a very big difference just in the setting that you work in. Now, I do want to point out that someone that works in a K through 12 school system might be paid 80,000 on average, but they also might have the typical schedule of a teacher. So maybe you have summers off. And so maybe though you're paid less, that is a benefit to you. So just, you have to do your research on what each of these settings might entail versus pick something just because you think you may be earning more. And then the third thing that matters in regards to your salary is how many years of practice. So both this and the geography slide are taking average. But when we think about a new graduate in your first year or two of practice, you're going to be paid less than someone who's worked for 10 to 15 to 20 years. So just keep in mind that these numbers are a little bit higher than what you would start with as a new graduate. As far as how can we help you, we've worked really hard over the last several years on our scholarship and endowment funds. So we had only $1,000 back in 2011, and in 2024 we awarded over $260,000 to our students. We have both prospective scholarships, meaning for incoming students, as well as current student scholarships. So anyone that's invited to our interviews at the same time will be invited to apply for scholarships. We have a separate scholarship committee that will review your application. You would submit an essay, and they would be determined who is awarded the scholarship funds. We do have financial resources. Both the American Physical Therapy Association has a financial solution center, and then we have an academic PT consortium that's called ACAPT that has this fantastic financial aid FAQ. I think maybe Natalie will be able to put this in the chat. It's a great resource when you're thinking about student loans, how much loans to take, what does that mean to pay off later? And then even our CU financial aid office, even though you're not a student with us yet, you are able to contact them and answer questions from them as well. So questions, I at least see, I have a question of column headers. Maybe that is for this slide. Correct? Mikey, is this the slide you're interested in? So the headers are the dates, the showing progression from 2010 to 2021, and then all of the different settings are listed down the columns. And then another question is, what is the median salary of recent graduate? That again largely depends on where you work in terms of setting as well as geography. So for example, if you worked outpatient orthopedics in the Denver metro area, you're looking at maybe 65 to 70,000 as a new graduate. All right, other questions? I only saw those were the most two recent questions. So Natalie, am I missing questions from further up the chat?
Yeah, no, I think we have gotten all of those answered as we've gone along. Thank you.
Okay, so we have one more question before I turn it to Natalie. Are your DP2 students eligible to sit for the exam? So actually, our students are eligible to sit for the exam in October while they're in their final clinical rotation and January. So some students decide to take it before they graduate. The downside of that is that they would be studying while they're in clinic, and that for a lot of students is not ideal to have sort of that divided attention. So other students wait until January so that they can dedicate a bit more time to their studies sort of at the end of their clinical rotation or in some weeks sort of between finishing the experience and taking the exam. Okay, I'm going to turn it to Natalie, who will do a deep dive into the application process and all those nitty-gritty steps. So Natalie, take it away.
Yeah, absolutely. Well, thank you all for being here today. I'm going to cover a lot of information coming up. And the first thing I'd like to say is if you have a case-specific scenario that you would like to talk to us about, please email us at our admissions inbox, and we'll put that up at the end of the meeting. And the second is you can take notes, but all of the information that I have is going to be available on our application website, which I have put into the chat. And so you can find all of the information that I'm going to cover there. All right. So what do you need to have to be eligible to apply for our program? The first is you need to have a bachelor's degree in any field prior to matriculation. And matriculation is just the fancy word for enrolling and starting with the program. So if you're entering your senior year, as long as your degree is completed before our orientation starts the last 3 days of May, you will be just fine. The second is you need to have completed the prerequisite coursework, which we'll cover in an upcoming slide. You need to have a minimum cumulative GPA of 3.0 or above. That's based on all previous course attempts, and I'll talk about that and give you a resource in an upcoming slide. And if you speak English as a second language, if you graduate from a U.S. university with a degree, you do not need an exam. Otherwise, you'll need a TOEFL or an IELTS exam, and please reach out to us if you have specific questions. The GRE is not currently required, and I will talk about that as well on an upcoming slide. So let's dig into some of these on our next slide. So what is a competitive GPA? For the class of 2026, that was a 3.63, and the science GPA was a 3.49. It actually went up a little bit for the class that we just admitted, and those are on our website if you want to take a look at that. We are looking for strong grades in certain courses that you will need to be successful in PT school, anatomy, physiology, upper division sciences, exercise physiology, and biomechanics. How did you perform in those classes? Did you take those at the upper division? All things we're interested to know. So when we talk about the GPA, as Laura moves us forward to our next slide right here, we know that the path to higher education can be different for all of us. And that the first year may be a little difficult, or maybe you or a family member dealt with illness or some challenges. So if your cumulative GPA is between a 2.7 and a 2.99, you may be eligible for application review if you demonstrate a positive grade trend, which we use as a marker as having a 3.5 or above for your last 60 credits. Now, PT-CAS calculates your GPA using all attempts at all courses taken. If you attended a school that had a grade replacement or a grade forgiveness policy, then those grades may not have been calculated into your final GPA for that school. However, not all schools have a grade replacement or forgiveness policy. So PT-CAS, looking at equity, calculates your GPA based on all courses and all course attempts. Now, that QR code that's on the screen is going to take you to the site for the PT-CAS GPA calculator. It's going to explain how they calculate your grades. It gives you a download of an Excel spreadsheet that you can put in and do the work to calculate and see how your GPA is going to look in the PT-CAS system. And it'll also tell you which classes make up their different calculations for like your sciences, etc., if you're interested in knowing about how that works in PT-CAS. All right. So what is the prerequisite coursework for CU? Well, the courses on this page do not have a time expiration. You could have taken them at any point. As long as you pass them with a grade of C or higher, we will accept them as a prerequisite. And that's going to be a full year sequence of general or college chemistry 1 and 2 with labs. If it's a quarter-based school, that'll be a 3-semester or a 3-quarter sequence usually. And the same with physics, a full year sequence 1 and 2, 8 semester credits. We are looking for a statistics class, 2 psychology courses. Now, the courses can be any class taught out of the psychology department, but if you're wondering what might be applicable to the career, developmental, or abnormal psychology are ones that we would recommend if you're not quite sure which class to take. And we also require an English composition or writing course. Now, while these courses do not have a time restriction, the courses on this page must be taken within 10 years of matriculation. So if you are currently applying, these courses need to have been taken in the summer semester of 2016 or more recently. If you've got a case-specific question or you're not certain if your classes will meet, please reach out to us at the PT admissions inbox. So we recommend within 5 years, just because recency, remember these, but 10 or more years are taken within 10 years. And that's going to be a 4-semester credit human anatomy with lab and a 4-semester credit human physiology with lab. Some schools offer an anatomy and a physiology. Some offer anatomy and physiology 1 and 2. Either sequence is satisfactory for us. If you're able to take it at the upper division, we are always going to recommend that. The first and most important reason is we want you to be better prepared for the rigors of doctoral coursework. And the side effect of being better prepared by taking upper division classes is it will impact the competitiveness of your application. We also require an upper division science class. Now, this can be anything taught from at the 300, 3000 level or above, coming out of chemistry, biology, physics, or engineering. But to fill the upper division science credit, we will also accept topic-specific exercise physiology or biomechanics. We know that some schools only offer those at the lower division. We will accept those 2 classes at the lower division, but we will encourage you to take them at the upper division if possible to better prepare you for the rigors of doctoral coursework. So when we talk about prerequisites, you can apply while you have prerequisites planned or in progress, but you can have no more than 1 outstanding science prerequisite in progress for the spring semester prior to matriculation. So if you are applying in this cycle, for example, and you need to take Physics 1, Physics 2, and Human Anatomy, are the 3 classes you need to take. You would need to have 2 of those classes finished by the end of December and only 1 of them planned for the spring semester. If you got a grade of C- or below, the class must be retaken. If you took chemistry and your chemistry lab and they were separate classes and you got a C- in one of those, yes, you would need to retake the C-. We don't average the 2 together. It is a C or above for each individual graded component. If you took AP or IB credit in high school for that chemistry, for one of the physics class, for a statistics class, for an English class, we will accept those. If it is not appropriately listed on your transcript, then you will need to get a report from the College Board with your grades on there. Trust me, if they can get mine from the 90s, they can get yours. All right, moving forward. And Caleb, you asked if for psychology, does a sociology course count? No, it does not. It needs to be taught from the psychology department. The only asterisk I'd put on that is a sports psychology department, which may come out of or sports psychology class, which may be taught from a different department. But please contact us with specific questions. Now, COVID semesters, if you took classes during the spring, summer, or fall semesters of 2020, and pass-fail grades were what were given in the class, we will accept those during those peak COVID semesters. However, outside of those 3 semesters, if you had the option for a letter grade or a pass-fail in a course, you must have chosen the letter grade as the grading for those courses. Again, please reach out to us with case-specific questions. All right, The GRE, a hot topic for a lot of people. We do not currently require the GRE for this application cycle, but we always want to let people know that the GRE and its role in admissions and success in PT school is a topic we will continue to research and discuss. So it may be required in a future cycle, and we will post that information on our website if there is a change in policy. Now, what is the GRE good for? Now, even though we don't require it, it may be something you want to consider taking as a self-assessment tool. We're very aware of the cost of it, over $200, but this can be an indicator of success on the NPTE. We suggest you take it if it has been a significant amount of time since you have taken a standardized exam. You may have gotten into college without needing to take an ACT or an SAT. It may be 5 or 10 years since you've taken a standardized exam. You may want to know if this is an area that you need to get some support in order to be successful passing that final national exam, the NPTE. We're a holistic admissions process. So we look at more than just the test scores. We look at things like academic performance, leadership, service, and more. And I'll talk about those on future slides. All right. So if you want to know about our policies, about our prerequisites, about all of this information, where are your sources of truth to find that? One is in PT-CAS. We're the ones who edit and control the information in our course, in our class, in our school page, so that you can find the information right there. And of course, the CU website, in our admissions information, our application information. We update that regularly if there are any changes or if we feel that the language has been unclear, we'll make updates to that. So what questions, as I pause, do we need to answer here? Mikey, you asked if verbal reasoning is weighted higher than the other GRE sections. We currently don't have a policy on how we do that because we do not consider nor review GRE scores for this current application cycle. So if that would be a question for other schools you're applying to about how they view the GRE as a part of their application process. For recent courses, and Erin, you're asking a specific class about a pass-fail class, please reach out to us directly. We'll put in the PT admissions email at the end. We'd love to have a conversation with you about that. You're welcome to send us documentation, syllabi, links to college policies. We can take a look at that and have a discussion about that moving forward. Other questions? Okay, so we are in the midst of our timeline. Our application always opens mid-June. June 16th is when it opened this year. Our application will close on October 1st, 2025. Please note that it closes at midnight East Coast time because that is where the PT-CAS offices are. Not midnight Denver time, it's 10 p.m. Denver time. So the application must be submitted before midnight East Coast time on October 1st. For now, it takes a little time for PT-CAS to verify all of your information. So during that process, please pay attention to your portal and any emails if there are questions or missing documentation. Your application must be verified by PT-CAS by November 7th this year. We do not control the verification timeline, so please work with PT-CAS until your application is fully verified. We will send out interview applications in early to mid-December, and all of our interviews take place over Zoom, January 13th to 15th of 2026. Okay. So we'll put this up at again at the end. If you've got that case specific question, that QR code is for us, as well as pt.admissions@cuanschutz.edu. You're welcome to send us questions. All right, so how do we look at an applicant? We have what's considered a holistic review process. We do, of course, look at your grades, but that is not the only thing that we look at. We're going to look at what classes did you take? If you had upper division science classes available, what kind of classes did you choose and how well did you perform in those? We're looking for a positive grade trend, not just how did you do in college overall, but how did you do in those last 60 credits? We're looking for that positive grade trend. With those rigor of courses, we also want to know, did you get a master's degree? Did you do research? Did you work as a TA or a tutor? Those are all things that are considered competitive. And there is a question in PT-CAS that asks, does your GPA accurately reflect your academic capabilities? Please let us know if there is a factor that we should consider when it comes to examining your GPA and considering that in the process. So we are looking for folks who are authentically engaged in their communities and things that are of importance to you. So did you have an opportunity to be in service organizations? Was it clubs? Was it Greek life? Was it, were you a student athlete? Did you work full-time or part-time to help pay for and support yourself or family members while you were in college? Those are all activities that we're interested in. We're interested to know, how did your engagement in the things you did, be it work or volunteering, impact the community around you? And how did being a part of those communities impact, change you, help you grow and learn new things? We're looking, if you had an opportunity to pursue leadership roles. PTs are leaders within the healthcare community. They're leading other healthcare workers, and they're talking to families through sometimes positive and sometimes really difficult conversations. So some examples of leadership roles could be being an officer within a club or an organization. Were you a manager or a shift lead at a restaurant or the store where you worked? Did you have opportunities to lead or plan large events? What else did you do? We're always interested and fascinated by the things that people have chosen to be a part of during their college and professional careers. Strong essays. This is where we get to know you. You want to include your personal experience and your self-reflection. Make sure you're answering the question that's being asked. And how can you stand out to the person who's going to be reading your application? Find someone, I always say, who loves you enough to not be nice when they read your application. You want someone else to proofread those for you and give you honest feedback to help you present the strongest evidence to support your candidates for any program that you're applying to. And the expectation is that the essays are written in your own words. All right. Observation hours are not required, but they are considered. What we're really interested in is, how did you learn about the PT profession? Going to PT school is a huge investment of time, energy, and financial resources. And it's very important to us that you've gone through the discernment process to make sure that this is the right choice for you and you understand the career that you're choosing to be a part of. Observation hours, of course, are an excellent way to do it, to learn more about it. But there are a lot of other ways to learn about the profession, including conducting informational interviews, not just with PTs, but with other healthcare providers. What do MAs do? What do nurses do? What do speech therapists do? How do they work with physical therapists? What about PT appeals to you as opposed to those other professions? Have you read the American Physical Therapy Association website for people interested in careers in PT? What did you learn? What do you think about the values that they shared there? Have you listened to podcasts? We're looking for all the different and authentic ways that you have learned about it and your ability to share with us how those experiences have impacted you and what you've learned. We do require 2 letters of recommendation from individuals who know you well. Our only exceptions are, we will not take letters from family, friends, or clergy members. The most common references we get are from professors, supervisors, and licensed physical therapists. And please know that your application will not be verified by PT-CAS until all letters are received, including those letters of recommendation. So we highly recommend that you ask for those letters early in the process, follow up with them to make sure they've finished it. And please, as you talk to those letters, the people who are writing your references for you, make sure they're aware that there is a box they can check that says this candidate can use their letters for all applications that they are submitting. And that way they do not have to continually approve sending out that letter. It makes it a lot easier for them on the backside and easier for you too if you've got some good communication with them. All right. So our application is done solely through ptcast.org. There is no supplemental application that you fill out for the University of Colorado, for the School of Medicine, or for the PT program. All application materials are done strictly through PTCast. In the application, you will indicate if you're applying for only residential or only hybrid, or if you would prefer hybrid but would accept residential, or prefer residential but accept hybrid. Please only indicate the path that you would be willing to participate in. There are no bonus points awarded for saying that you'd go anywhere if you would really only prefer to be part of the hybrid, or you would really only prefer to be part of the residential. We do have checkpoints along the way of our application process as you learn more about us. If you would like to change your path preference, we do have formal opportunities for you to submit that information so that we can change that in your application for you. All applications are submitted to PTCast. You do not send anything to us. Don't send us your letters of recommendation. Please do not send us your transcripts. Those all go to PTCast centrally delivered. The cost for PTCast is currently $170 for your first application, $70 for each second application. That fee is paid directly to PTCast. Thanks, Laura. All right. So everything goes to PTCast. Now, this includes if you took any dual credit high school classes, if you were in a concurrent enrollment situation or running start, those transcripts get submitted as well. The references through PTCast. There is only one thing that comes directly to CU, and that is we have a $25 supplemental fee. We are very thankful to our program director who has helped us lower that significantly over the last few years. The website is linked through PTCast, and that is in addition to the $170 PTCast fee. Now, if you have not sent that in, we will not review your application until we have received that fee, but I will send you an email just in case we haven't received it so that we can work through that process together. There is a fee waiver through PTCast. If you are eligible for the fee waiver in PTCast, please forward us the documentation and I'll work through that process with you as well. Thanks, Laura. All right, so it usually takes PTCast 4 to 6 weeks to verify applications. Now, sometimes we see them verified in as fast as 1 day if all the information is in and accurate, but there can be delays in the process. So even though the application is due October 1st, we highly recommend that you get that application in early so that your information can be verified and we can receive that application. We recommend mid-September. If your application has not been verified by early November, it may not be eligible for review. We do not have a rolling or early decision. There is no benefit to you for getting that application in earlier. We want you to submit it when it is complete and full. Please, we highly recommend that you order transcripts that are complete early in the process, as well as start working with your letters of recommend early in the process, just because you can't control how quickly other people click boxes and put things in the mail. All right. If you are successful and move forward to the interview process, our interviews are by invitation only. Our invitations are done virtually. We do not have in-person interviews. If you are invited to interviews, you will be invited to 2 interviews. They are one-on-one interviews with faculty or clinical partners. And again, those take place in January the 13th through the 15th. So for our most recent application cycle, that's that top block of numbers there, we had 1,285 applications submitted, 396 individuals were invited to interview, 260 completed the interview process. And we matriculated a class of 70 for our residential cohort and 40 for our hybrid cohort. And those facts are available as well on our webpage in case you're interested in looking at those. So as promised, once again, here is our admissions inbox. If you have specific questions about coursework, about anything about our program, please reach out by email. We are more than happy to work with you through that process. And what questions do you have for Dr. Canham and myself? Brandon, your hand is up. Hi.
Hi. I just wanted to ask, and I had asked you beforehand, but kind of what is something that you wish that more applicants knew, kind of, I guess, applying to your guys' program and just applying to like the physical therapy program in general?
Well, that's a good question. So maybe to our program specifically, I think we address some of the things that are unique about our program. So we want to make sure that you have some of those same shared values. So, serving our community, being involved in our interprofessional collaboration with all the other disciplines on campus. If you're in the hybrid pathway, serving your home community. That was a big reason we established a hybrid pathway, is for those of you that maybe want to serve your communities, is giving you the platform to do so. So that's just something we wanted to have you hear loud and clear. And then I think from thinking globally amongst all programs, I think Natalie nailed it. How you got to tell us and other programs why you want to be a PT, right? You've done your exploration, you've shadowed, you've listened to podcasts, you've gone to the APTA website. You know what this career entails because it's a lot of time and money invested. We want to make sure you really know that you want to do it. So those would be my highlighted pieces.
And we're really interested in helping anyone who's interested in the PT as a career, consider what to look at when choosing a PT school or getting ready for that. So we are actually piloting a student checklist for people who are considering applying to PT school. We are trying to get feedback on it, things you liked, things you wish were there. And I already have timed. I'm going to be sending each of you on this email, or each of you on this meeting an email. It should get delivered to you at about 11:30 this morning, right after we get off of this call. It's a quick. You've a link. You've put in your name and your email address. We will send you a link to the student checklist as well as a PDF of it you can download. 24 hours from now, you will get a second email saying, hey, could you give us some feedback? And if you would be willing to take 3 minutes to fill out the survey and let us know what was helpful, what you wish we had more of, or what you think didn't need to be there, we're really looking to make a resource available for anyone, not just CU applicants, but anyone interested in PT school. So Brandon, thank you for asking that question. Diego, I'm going to pause you just because you've already asked a couple questions. Sophia, what question do you have for us? And then Diego, I'll come back to you.
Yeah, absolutely. Thank you for taking me. I was looking at the application, and PhD is something I'm looking into. And what percent of students go through that pathway? Do you have any more information about that? Because I saw that it said students who are interested in their first or second year start that conversation and continue that process. So yeah, do you have any more information on how many of your students go through that process?
So while I answer you, I know Natalie is going to put in the chat the link. So we have two options for advanced educational opportunities, one being the PhD pathway that you mentioned, and the second is actually a dual degree MPH, so Master's in Public Health. Both of those opportunities we have linked, Natalie will show you here. And here I'll overlay the general outline. So students, we ask in the application, are you interested? Simply because if you're invited to interview, we're going to purposely try and pair you with somebody who's involved in either the PhD program or the MPH program so that you can ask them questions. So it's really the only thing that we generate from the original application. Then, if you really are interested, you're going to continue the conversation with the people who are involved in those two opportunities within that first and second year of being a student. So, if you're interested in the PhD, you might start working in a research lab. You might start getting your feet wet with some of these questions that you have. With the MPH, again, getting involved in some of the other opportunities on campus with our public health groups. And so once you decide that you want to do it, there's a formal application for both of those processes. Traditionally, we have about 1 to 2 students in every cohort from our residential pathway so far do the PhD program. I can't speak to the hybrid yet because our oldest students are in their second year, right? So we still have people that are just exploring that. And then the MPH program is relatively new. We have a student starting that our first student starting that this year. So we anticipate 1 to 2 students from each cohort to take advantage of these opportunities. But it could be more. We don't have a cap on it, so I don't want you to think, oh shoot, there's limited spots. This is just who happens to be interested.
Thank you.
All right, Diego's going to ask our next question, but I just wanted to make a note that our hybrid students are considered fully CU Anschutz students, even though they do their immersions at the UCCS campus. So anytime you're trying to find information about financial aid, about veteran and military benefits, about residency questions, Google for the CU Anschutz and then the department that you're looking for, because all of that is administered by our CU Anschutz students. So UCCS, phenomenal staff down there, amazing. However, all of the administration and the questions should be funneled through the CU Anschutz campus. I just want to make sure you get the information you need. Diego, thank you so much for your patience. What question can we answer for you?
Thank you for getting to me. I guess my question is, I was looking at the stats you had up earlier, where you have like over 1,000 applicants. You invite over 300 people to interview, and I can probably confirm, or you guys can probably confirm that every single applicant that you invite to interview is exceptional in their own right. And I could probably guess that every person in this Zoom call is exceptional in their own right. So I just want to know, what are some things when you're interviewing them that really stick out to you that make you choose those 70 people? Because I could assume that the difference between two applicants that didn't get accepted and did get accepted is so small. So I'm just so curious about, like, what else do you see that we're not seeing?
Diego, that's a great question. And you're so right, because if you think here, I put the slide back up of all these applications, someone might write, oh, I was a personal trainer and I got this certification and therefore pick me, I've got great background. Well, out of those 1,285, there were probably 40 that were personal trainers and had, so with every sort of given unique thing, there were probably a handful of people with all those unique things. So when I talk about, or when Natalie and I both talk about this holistic review, I want you to understand we're looking at all these different things. So some people really rise to the top in one category, and then maybe they're, average in another, and then others, so everybody has their scales that are going all at different sort of heights. And what we're trying to do is have the most holistic or most comprehensive. So, somebody might come in with really strong academics, but maybe doesn't have as much service. And equally, we might accept someone who has exceptional service background and a commitment and displaying their sort of credentials and their extracurriculars, and their academics aren't as strong. So all those pieces end up sort of weighing each other out in our total picture. So if I were to give sort of advice of what should you do as you're applying, the biggest thing is, how can you stand out? So Natalie mentioned those essays. If you are that person that's a personal trainer that got this certification, well, beyond just telling us that, tell us some specifics. What did you learn from it? How did you identify how it helped the people you worked with? How did you grow from that experience? What is someone who you perceive as the most sort of role model in that realm? What is considered poor care in that realm, right? We want you to give us some depth, some insight. That's what we're looking for, versus just check the box, I did this thing and I moved on. So if you can reflect on your personal stories, some anecdotes, some experiences, that's really what's going to make some things rich and help you stand out, both in your essays and in any interview questions.
I think too, regardless of where you are applying, we can't write the story for you. So please make sure your list of work experience, of clubs, of organizations, please make sure it is full and robust because we can't just invent things for you. So please tell us about that so that we have evidence to support your candidacy. And additionally, regardless of where you're applying, we recommend as you look at the application, pull out all of the places where you're going to be writing essays and look at them as a mosaic. Look at it holistically. Where can you put all of the evidence? And remember, the same person will probably read your application from tip to tail. So, you can repeat information, but you want to give new information, new evidence to support you in your candidacy. Make sure you're reading the question and asking the question that is being asked. Erin, you've got a question. Hi.
Hi. So I actually really appreciated the conversation regarding interprofessional activities in education. And I was just wondering if that's referring specifically to clinical experience or also to didactic experience.
Great question. So both. Let's see if I can somehow get us back in the slides. Ooh, I did pretty good there. I'm guessing which slide it would be on. I'm going to go back just to the, oh, am I going the wrong direction? I'm sorry. Now I did well, and then I lost it. Here, this slide. So IPED, if we see what that stands for, Interprofessional Education and Development, you'll see that IPED as an actual course happens at the bottom of the first column, Spring 1. So this is an actual course within our curriculum. You are on campus if you're residential students, meeting in person with med students, pharmacy students, dental students, nursing students, and you're going through cases, ethical scenarios, you're learning about each other. If you're in the hybrid pathway, you're doing this all virtually, but same thing, you're in these groups with other students. So IPED shows up, if you see here, multiple times in the curriculum. There's something else called IPE clinical transformations. This is actually utilizing those standardized patients, those patient actors and actresses collectively in your groups. And so there's a lot of opportunity both clinically as well as sort of within embedded in the curriculum academically for that interprofessional care.
All right, we're coming up on the end of our time today. I want to thank you all for being here. I want to thank Dr. Canham for her time. I want to thank you for all of your fantastic questions. This session is being recorded. It will be posted later today once we've processed it and uploaded it to YouTube on our admissions overview page. I'll put the new link to the new video there. And there, once again, is the email. Oh, I managed to cut it off as I put the link in, but it's pt.admissions@cuanschutz.edu. We look forward to your questions. We look forward to seeing your applications. We wish you all the best. And thank you again so much for being here today.